Commissioner of Insurance is Wisconsin's insurance watchdog, and we have a duty to educate consumers about the types of care available to them in our state. In honor of National Recovery Month, we're bringing you a conversation with two experts from the State Council on Alcohol and Other Drug Abuse, also known as SCAODA. Let's hear what Sandy Hardy and Christine Ulstrup have to say about substance use disorder treatment and what's covered for most people in Wisconsin.
Sandy, thank you so much for joining me today.
Thank you. I am so privileged and honored to be able to have this conversation with you.
I'd like to start by asking you to share a bit about your work in recovery treatment and how that informs your role at SCAODA.
Sure. I have been working in the recovery field for about 35 years, working with probably the last 15 years or 20 years, maybe now, specifically with women with substance abuse and trauma, and have recently in the last 10 years founded a program specific to that in our state. We are located on a horse ranch, and so we have equine experiential learning as a big part of our program. And I think I really bring that lens to SCAODA and having a voice on that council as well.
Certainly.
And then I will also, I will also say that I'm in long-term recovery myself. And so I'm very passionate about making sure people know that people in recovery can go on to do really great things in, we can forget that one. You can edit that out.
Well, I think it's important that we share, National Recovery Month is the campaign that they use is Faces of Recovery. And
Right.
Like you said, there are so many people doing really important work and who are also courageous enough to step up and say, I am a person in long-term recovery.
Yes, I think we definitely need to be out there and speaking that.
So Christine, you also work with women in recovery. Could you tell us a bit about your work and your role at SCAODA?
Sure. My role at SCAODA is I sit on the council, and I'm a appointed community member that represents the treatment community. And then I also head up the Planning and Finance Committee, who really takes a look at funds throughout the state and how can we best use those to make sure that there's adequate treatment and education and prevention. And that's what that committee works on.
Certainly all very important.
Yes. Yes. And then if you want, my work, I work with women in my job, and my job is at Maida House, which is in Milwaukee, Wisconsin. We have always done gender specific treatment. So we've recognized that women doing treatment together is very important. And we have this full continuum of care, starting with our lowest level of care would be our outpatient clinic. And then it goes up to 15 family units where moms can live with their children.
Wonderful. So let's get into the relationship between insurance and recovery. Using insurance as a metaphor, we pay premiums to protect us from big costs in the event that something goes wrong. And
Right.
Treatment like the kind offered at your facility is a type of investment in the long-term well-being and continued recovery for people struggling with substance use disorders.
Absolutely. And I think looking at the physical health, because when we look at how substance use, trauma, and mental health impacts physical health, I mean, we are saving money in so many areas if we invest in treatment.
Absolutely. I mean, we know from research and from the work that we do that it's not that we want to keep people at the residential level of care just to keep them there. So we want to have people in the residential level of care, as I said, for the amount of time that they need to be successful, and then transfer them to that lower level of care. And insurance companies, if you pay that premium or if you're paying into the system, you're really going to save money down the line. because when the disease comes back, it usually comes back pretty powerful and pretty quickly, which can lead to all sorts of other costs for this person. So treat it up front, treat it well so that you don't have those costs in the future.
Very well said. And I'm glad that you brought up this relationship between the body and mind part of treatment, because I wanted to bring up something called the Mental Health Parity Act. For our viewers at home, that is Parity. It's not like the kind of parody you see on SNL, but rather that is a term that we use to talk about recovery at the policy level. So, for example, health insurers in Wisconsin are required to provide for a certain level of mental health and substance use disorder treatment. Christine, I'm wondering if you can tell us why parity is so important in recovery treatment.
It's so important so that people can get the care that they need at the level of care they need. And it also takes away the stigma that's associated with substance use disorder and mental health disorders. So it's to be built into your medical plan, into your insurance plan. So it's just a different category. Here's, physical health. Here's your mental health, your behavioral health. Here's maybe a benefit you have for physical therapy. Sometimes they break that out, or dental. So all of those should be treated the same. You shouldn't have to jump through more hoops to do one or the other, or have to prove. I think that's the other thing about addiction, often in mental health. You almost have more times, I get the sense or the feeling that you have to prove that you need this. Nobody necessarily says that to you. Well, prove to me that you have this, or prove to me. They take the word of the professional saying, the doctor says, no, they have diabetes, I need to treat them for diabetes. Substance use disorder therapists who are qualified can do that same thing. They can make that diagnosis, and then the treatment should be there that matches the need.
Again, I think we need to look at what someone needs when they come into treatment, and look at what level of care they need, and making sure they get that level of care, versus just simply saying, this is how many dollars you have to spend on this. And so I think it's so important for us to look at that just as though somebody with another illness doesn't follow through, they're not looked at the same way that somebody with substance abuse and trauma was, especially in the past. I think that's changing, but that's why parity was so important, so that we can be at that same level and get the care for this illness as others do for other illnesses.
Absolutely. I think there is a growing social movement to reduce stigma in the way we talk about substance use, and the way we talk about addiction, the way we talk about treatment. One of those things actually leads us right into our next question, which is about recovery supportive workplaces. So let's say I am someone in Wisconsin with a small business, or I'm a manager. How can I make my workplace recovery supportive?
I think there's certainly a few things you can do right from the start. I think being able to have your employees know that they can come to, whether it's an EAP program, or whether you're small enough you don't have EAP, but there's somebody within that employment setting that will be able to talk with them and keep things confidential. I think the other thing that would be very helpful is for them to be able to have some flexible time to maybe go off to do their counseling, those sorts of things. Sometimes it's really hard for people in the shortage of providers today to always get appointments after work. And so if somebody could have an appointment at a different time and get in, those kinds of things, I think really states that we believe you're important. Really knowing that your employees, once they're in recovery, are going to be so much more productive, and also just their frame of mind is so different, and they become such an exceptional employee that you will start to see the benefits. And I think any support that an employer can give, and let them know that it's really an environment that is positive towards recovery.
Yeah, there's a movement now that's really talking about workplaces that are recovery oriented. And so it's out there already. And so it's recovery welcoming. And so it's, from the get-go, from the first time you're applying there, you've already seen that, and maybe on their website or something, that they're already inviting someone who is in recovery to come work for them. And they have set up a system where people either feel free to talk about that or don't feel stigmatized, both at the same way. So, not everybody might want to talk about their recovery, but if they go to a company event where there is maybe alcohol served, they don't feel shamed or put on the spot if they just refuse, because it's just an atmosphere and a culture that's been created where people recognize that recovery is a thing, that not everybody drinks, not everybody partakes in recreational drugs of some sort.
Absolutely. I think as we talk, what it all comes down to is that there are a lot of benefits that people might not consider for supporting recovery treatment in Wisconsin. Mm-hmm. What do you think the future of recovery looks like in our state?
I'm super optimistic. I really am. I know it's dire times and people are dying. There's no question about it. It's scary. It's scary. The overdose rate, that there is, fentanyl and carfentanil on the streets, and it's being laced or put in the other drugs. So even if you're buying marijuana on the street, it could be laced with a substance that's illegal and might kill you. So, it's scary times in that sense, but I'm optimistic because I think there are a lot of people working on this, and that there have been dollars infused from the federal government down. Some of the opiate settlement dollars which are going, across the nation, and a lot to this state and to the various communities, the various counties across the state. And so there's going to be more services available. There's going to be more prevention work out there. There's going to be that prevention includes more education, more access to Narcan, which is a life-saving drug that can be administered if somebody has an opiate overdose. So I'm very optimistic that way. What's a little scary for me is the workforce. So we need more people entering this field and wanting to do the work to help people with this chronic disease. So that's an issue that I know the state is starting to look at, and I think the universities are starting to look at very seriously about how we get more people interested in the profession and get them through school and get them good jobs, et cetera.
Right. Right now we're seeing definitely not enough treatment providers. And for those of us that are treatment providers, we certainly are not having enough staff available, as in pretty much everywhere right now. So that definitely, I think, is something we're looking at. I think there's some positive things too. In the last several years, we have put together programs that now we have recovery coaches and peer specialists, which are support systems to recovery programs, but also outside of recovery programs. So I think those are very helpful. I also think the fact that because of the opiate epidemic, we're having much more honest conversations about substance use in our society. We're in Wisconsin. I don't want us to forget about talking about alcoholism as well, right? We always rank high on that. And so I think more conversations are happening, which I think is very helpful.
So Sandy, as we come to the end of our interview here, I wanted to give you some time to speak directly to people who might be struggling with substance use disorders or struggling in their recovery. What should they know about where they can go to get help?
I think there's a lot of resources out there. As I talk about, there's a shortage, there is, but I think there are good resources out there. So you can always go to your county human services department, contact them directly. There's a lot of self-help groups out there, whether it's Smart Recovery, it's AA, NA, those you can always go to and access at no cost. And there's a lot of meetings at different times. There's recovery coaches and peer specialists. Again, if you go to the DHS website, those are listed on there. So there is access to that, or just calling a treatment center, because one of the things, I get a lot of calls from people just asking for those kinds of resources. What do we do? I talk to a lot of family members who are really struggling, trying to get help for their, young adult children. And it's so hard as a parent to see them struggling. So it's also important to get resources there for the families, and continue to follow through with them. And I always say to them, if you're still stuck after trying these resources, please call back, because there's nothing worse than that, feeling so alone in trying to get your loved one help.
I mean, if you have a loved one that you want to support, the best way that you can support them is to love them and to encourage them and to help them get to treatment, and to realize that nothing's going to change necessarily overnight, and it's a process, and you're going to be there through the whole thing, encouraging them and loving them and supporting them. I would encourage that person, or I'd help that person to do a little research on where they might go, because treatment works if it's good treatment. It's just the same. I mean, you want a good doctor, you want a good surgeon, you want a good orthopedic surgeon when you're going to have, body parts replaced. You want a good treatment facility. So do a little research, ask questions, go to their website, look at their history. How long have they been around? Doesn't mean that somebody who just opened won't do a good job, but you want to know how they're going to do that. Are they using evidence-based practices? Are they client-centered? Do they really care about you? Do they just look at it as insurance billing, or do they really care about what services they are giving to you?
And again, treatment centers are available to just call and talk with somebody.
That's so important. I think that it's great to remember that, calling and talking to someone to ask questions about what your next step might be is free. And there is a lot, like you said, a lot of free resources until, maybe people are in the process of trying to secure insurance coverage for longer treatment.
Right.
And can never hurt to ask, whether we're talking about recovery or any other question that people might have.
Mm-hmm.